Welcome to Your Health is Wealth podcast. The podcast invites you to embrace the profound truth that your health is your wealth. I'm your host, Kristen Burke. This podcast aims to take you on a journey into the landscape of alternative medicine, integrative practices, and holistic healing options that empower you to thrive in mind, body, and spirit. Today in our segment titled Episode 11, From Critical Care to Root Cause, an ER nurse's journey to integrative Ayurvedic medicine. After 18 years in critical care in emergency medicine, today's guest witnessed something that changed everything. She watched patients cycle through the same doors again and again with the same preventable conditions. She saw young adults in their 20s facing advanced stage cancers, while medical establishment focused solely on treatment, not prevention. She realized that what we call healthcare is really sick care, a system brilliant at managing symptoms, but blind to the deeper patterns of imbalance that create disease in the first place. What she discovered in ancient Ayurvedic medicine wasn't just alternative healing. It was a missing piece of the puzzle, a 5,000 plus year old system that views each person as unique. It sees disease not as bad luck, but as a final alarm bell after years of ignored warning signs, and that offers something revolutionary: proper prevention by addressing root causes before symptoms ever appear. Today, we'll learn more about how this integration of ancient wisdom and modern medicine could transform not just health, but our entire approach to healing. This is about not treating disease. It's about preventing it, understanding it, and empowering people to reclaim their health through wisdom of their own bodies. Please welcome our guest, Krysta Clark, an ER nurse who is now an Ayurvedic practitioner, who has taken both of these practices and uses them in her integrative health practice. Welcome, Krysta. Thanks for being here today.
Thank you. It's good to be here.
We're going to jump right into the questions, okay?
All right.
All right. So after 18 years in critical care and emergency medicine, as a nurse working in that field, what was the pivotal moment that made you realize that modern medicine wasn't addressing the full picture of health?
I don't think it was really just one moment. I think it was like an accumulation of multiple moments over the course of time. So when I first got into healthcare, I was like 18 years old and I was working in nursing homes. And when you're 18, you don't really have a good understanding of what that stage of life looks like for people. And you get into the nursing home and you're like, oh my gosh, these people, usually you think that they only stay there for the last like year or two of their lives. And you're like, oh my gosh, these people have been here for 10 or 15 years. Or if you have a stroke when you're 65 and all of a sudden you're debilitated and you're in this nursing home for years and years. And I'm like, that's just such a huge chunk of your life to spend in a nursing home. And the quality of life is just so diminished. And then moving on into my nursing career. So I worked in ICU tech for many years. And then I worked in cancer research. And the bulk of my career has been in the emergency department. And a lot of the emergency department I would ask these questions as a tech before I was a nurse. Like, how does somebody end up with their leg getting amputated? Like, how does that, like, what causes that? What has to happen for somebody to lose a limb? And doctors would be like, it's just one of those things that type 2 diabetes gets out of control. It can happen. You get infected, ulcers, wounds, wound healing is impaired, all of those things. But how does type 2 diabetes get out of control? Like, how do these things happen? And just the conversation always just sort of stops there. And I started really looking for the answers of, all right, there must be more of this. This just can't happen out of nowhere. So that was the baseline, I guess. And then building up into my years in the ER, I would just see the same thing over and over again. We treat symptoms, and there's a lot of it's just these diseases that are preventable, and that's not what we do in the emergency department. We don't prevent it. And you're like, whose job is it to prevent it then? And this is where it stops.
I would imagine it would be different in the emergency room versus a regular clinic. They might have different functions. What do you feel about
Yeah, the
that?
emergency department is usually you have an immediate need, an immediate pain, an immediate something that's either life or death, or it's causing you so much pain that you're like, I need this taken care of right now.
I had some previous guests that were on that, one of which was a doctor that worked in the emergency room in Southern California. And he mentioned the primary purpose is really to just keep people out of the danger zone and prevent death, essentially. And it's not necessarily to dive into the root cause in the emergency room. So would you say that in a clinic, or maybe let's say a private practice or a healthcare system where you're going into your doctor, do you think their approach might be different than the emergency room when it comes to the root cause, or do you think it might be similar as far as the root cause approach?
So that was one of my things as when I was a tech, moving into being a nurse. And I was like, we're always seeing the worst of the worst. That's what the emergency department is. So I was like, they must be having these conversations with their primary care providers. They must be having these conversations like with somebody else. And and the more when I started my degree in Ayurveda and integrative medicine, you have a lot of you make a lot of assumptions. Like a lot of different worlds make assumptions about each other. Like they're not doing enough for prevention. Maybe they are. Maybe I just don't know because I haven't asked the right questions. And as I was going through my degree, I would ask and I was like, so what has your doctor talked to you about diet and what you can do? And they're like, and a lot of the times the answers that you get are very, well, they just tell me to eat better and exercise, or it's very vague or non-existent at all. So when I would ask patients that question, because I'm like, I don't want to just make assumptions because I work with a lot of amazing doctors and nurses, and I don't think we're all here to just put Band-Aids on things. Like we want to get to the root cause, but that's not what the system is set up for. But when I started asking those questions, no, people actually aren't having these conversations with these patients. Like they don't actually discuss what does it mean to change your diet and lifestyle. And as you know, with Ayurveda, what is good for one person isn't good for everybody. So it really needs to be a personalized diet and lifestyle approach is personalized.
I totally agree with that. The other thing too is the emergency room may be getting a lot of patients coming in there where they should be seeking out the care with the urgency care or the regular practitioner, but because of delays in seeing their doctors or a specialty, let's say, for example, there's someone who has really bad symptoms that might be related to pain and they're referred to a specialist. What I'm hearing is there's usually delays with months sometimes to see that specialist. So in the interim, when they're just trying to figure out if they're scared, right? They'll go to the emergency room to at least get some diagnostic testing or some treatment just to help them in the meantime while they're waiting. Has that been your experience working in the emergency room?
Yes, that happens so often. You hear patients constantly that my primary care doctor told me to come here, even if they're waiting for outpatient MRI or outpatient neurology or outpatient, whatever it is that they're waiting outpatient for, and they've been waiting for so long. And a lot of times their symptoms are intermittent, so they'll come and go and they get nervous by it. They're like, I can't wait for the month or two appointment down the road. And they come into the emergency department. So that is a lot of what we're seeing is patients that just they're falling through the cracks because they're like, my symptoms are very real. I need answers. I'm not getting answers and I can't wait for this. So it's frustrating in both ends because we're seeing this. That's great. Your primary care doctor told you to come to us, but that's not good use of emergency services. But then for them, they're not getting the answers they need. So you can understand both sides and it's a hard place. But unfortunately, that is a very common scenario in the emergency department.
Yeah, that's got to be it's just a lot to take on in that field. And then also I'm hearing too that it's frustrating for doctors and nurses because they do want to offer more time with your patients and clients, more of an in-depth approach, but they're limited by the system, it sounds like, or systems within different healthcare systems seem to look at the strategy of efficiency with moving people in and out of the ER or the clinics, and a prioritization of that may not make sense to us as clients and patients.
Yes, very much. That is definitely like what happens in a nutshell.
Just going back to before you started nursing, what encouraged you to get into the nursing field to begin with?
Well, I really I just was trying to find, both young, I was just trying to find a career that would like make a difference in the world. Like I had a kind of an interesting background growing up that I really just didn't make sense to me, the whole 9 to 5 office job scenario. And a lot of what I heard from the adults in my world was that they didn't feel like they were doing something that was really meaningful. And I really wanted to find a career that felt meaningful and like I could make a difference and just help in some small way. There's so much yuck in the world sometimes. And it's nice to be able to make somebody's day, even if it's little. Sometimes it's bigger, but in the emergency department, you get to really be with people in their worst days. And if you're able to have the compassion and the patience to sit with them in those moments when they're yelling or screaming or in pain or just really struggling, and you will be that person to just hold space for them, it is really rewarding.
Thank you for what you do and what you have been doing. And your heart is in the right place. And also to it seems like you're searching for a better way. It sounds like you were inspired to help people, but now you're like, let's try to take this to the next level.
Yes, very much.
That's amazing. Thank you so much for doing that. So you've described some of what a lot of other people have said with modern medicine, where there seems to be a focus on symptom management versus the true prevention of imbalance or illness. Can you paint a picture of what this looks like in practice?
Yeah. So I think you can go anywhere from the very obvious ones to the more subtle ones. But like the most obvious examples is like the COPD exacerbations that come in and they refuse to stop smoking, or they're chronically on oxygen and they're so committed to smoking. Like that one's super obvious. But then you have the other ones where you have somebody who they've had like vague symptoms of belly pain or back pain or constipation. And it's just this ongoing thing. And they come in and we do the labs, we do the CAT scan, we do all of the things. And we say, we didn't find anything. There's nothing wrong. Go home. And then when you have those same people coming in, and this is where you get that people don't care cliche in healthcare. It's, oh, they're crazy, or, oh, they're this. And it's, no, their symptoms are very real. Like our symptoms are always real. And just because our diagnostic tests aren't finding anything, like it doesn't mean that that everything's okay. So that is the part that was really frustrating for me, especially as a new nurse in the ER. I was, oh, but we didn't tell them what's wrong with them. And they're like, yeah, we don't always. And it was just this moment of, oh, we don't always know what's wrong with them. Like we can't ever send them away we don't always send them away with a good answer. And that is really frustrating. And I think the other part that is hard is the guilt and shame that comes when you try to confront somebody. It's not confronting. It's like you're trying to ask them, we can only do so much if you keep smoking. We can only keep giving you so many steroids. We can only keep giving you so many nabs. There's so much we can do if you are really committed to continue smoking. And people, it's one of our like general information questions. When people first come in, it's like one of those like state mandated, you just have to ask, are you a smoker? Are you this? Are you that? And people get really defensive. Even if they're not here for respiratory, it's just a question you happen to be asking. People get very defensive. And because a lot of the stuff that's happening now, it does have to do with weight. I think diet culture has given us people like have this, if you try and talk to them about weight, it's not about body shaming. It's about health. And you have this, we have these young people coming in and they're 100 pounds overweight and they're hypertensive and they're on medication for it. And you want to have those conversations with them. And you just see this like guilt and shame wall go up and they get very defensive. And you're like, we don't want to attack anybody. We're never trying to attack anybody. So I think that's one of the big barriers about why we do just stick with symptom management. We're like, if we can just give you some drugs, if we can give you something that's going to make your stomach ache go away, if we can give you some IV hydration, we're going to do that and not have those hard conversations, because it takes a certain level of vulnerability on both sides to have those conversations that are really going to get somebody to understand like, oh, I have power in this. I could actually change it.
Yeah, that's a difficult path sometimes to walk. And also you're limited in time with the clients or patients.
Yeah, especially in emergency.
Oh, absolutely. And there's so much confusion. It just seems like in the Western world, eat more fat, eat less fat, eat more carbs, eat less carbs. And really, none of these things seem to actually address the issue with balancing our digestive processes, which we know directly connects to the mental health of the person.
Yeah.
And the endocrine system, all of these systems. There's a delicate balance to it. And it just seems like there's so much information out there that people do seek on their own. none of them actually seem to address the whole person. It's here, take this new formulated supplement, which is, in my opinion, a swap from a pharmaceutical drug, right?
Yes, it is.
It's just treating a symptom and not addressing the root issue. I get nervous when I hear people in the quote unquote functional medicine area, because it seems like there is a trade-off for one versus the other. There doesn't seem to be a true root. Do you have any insight?
No, totally agree. The root cause, it's like there's multiple levels of the root cause. And it's like we're starting to get more down in the layers, and the supplements is like another layer down. So we're closer to the root cause, but we're not quite all the way there. Like I was having a conversation with a patient who was a young man, like 29, 20, 30 years old. And he came in because he had a cough and a little bit of chest pain. And he was hypertensive, his liver enzymes are bumped, and he had a little bit of a white count bump. And we essentially told him that there wasn't anything wrong, we couldn't find anything, and sent him home with antibiotics. And I was like, but if you look at this through like the eyes of Ayurveda and some of the functional health research that's coming out, his waist circumference is very large. He's very hypertensive. His liver enzymes are bumped at that young of an age. These are all things that paint a pretty clear metabolic picture. And we didn't talk to him about any of those things. And I've been trying to do better with my client education when I discharge patients. And I talked to him. I was like, oh, did they talk to you about your liver enzymes? And he was like, no. He said they were nothing to worry about. And I was like, oh, okay. And I talked to him. He's like, yeah, I know. I'm trying to cut back on drinking, cut back on this, cut back on that. And he had this very defeated, like he's in trouble. And if that's not what I want to do. I don't want anyone to feel like they're in trouble. And I was like, no, you're really young and you have a really long life to live. And your body's throwing up this check engine light. Yeah. So it's just telling you to pay attention to it. And when I was done with the patient, I went and talked to the doctor and I was like, hey, he said that we weren't worried about his liver enzymes. And he was like, these aren't signs that you wouldn't be worried about. This isn't hepatitis or anything like that. But what you're saying is that so he's not that sick enough to have a serious disease. But this is still a precursor to major metabolic issues combined with his waist circumference, combined with his hypertension. I could be describing one of a gazillion patients that I've seen. This isn't an uncommon occurrence. It's like our threshold is healthcare is a check engine light that only goes off when the engine is already smoking and has unrepairable damage done to it. We wouldn't rely on a system like that, but then that's exactly what we do with our healthcare. We ignore all of the check engine light, all of the subtle signals, the quiet things. And then when something big happens, we're like, oh, I don't know what happened.
That's a great analogy, actually. And you're talking about that this individual had hypertension and issues with the liver, and we know that the renal system and the cardiovascular system work hand in hand.
Yes.
Let's think about this. If you have liver issues and you're not breaking down enzymatically larger things to a more simple form, it makes it difficult to move through the body. Some of the things that could be causing this would be blockages in what we call shrotas, right? Like those channels. So we're having blockages that creates pressure. We see increase in blood pressure. That's your caution sign, right? Yeah. That's your body telling you, hello, you're putting stuff in here that I can't get rid of easily. Right. I can't break it down into very simple forms so I can excrete it through urine, breath, sweat, feces, whatever. But also it creates an opportunity for an increase in toxins in the body.
Yeah. And I'm glad you brought that up. I was thinking about that the other day. I was thinking about the whole keep the shrotas clear. That was one of the shlokas that we learned in class is keep the shrotas clear. And so many of the things that we see, it's a failure, not failure, but the body's inability to clear metabolic waste. So gallstones, kidney stones, cysts, fibroids, abscess, like all of these are the body's holding on and building up things and obstructing things because it's holding on to and can't excrete this metabolic waste. And that's exactly what Ayurveda teaches, is why it's so important to protect your metabolic processes, our Agni, our digestive fire. And that doesn't just mean in our belly, it means in all of our tissues, everywhere in our body. So it's all of so many of the things that we see, the chronic inflammation, all of the various types of stones and things, those are all, it's blockages and stacking up of waste. So that's why Ayurveda was so special to me in that respect.
And speaking of some of the terminology some of the audience may not know what a Shrota is. Do you have a quick basic description of what that is and what it does? Importance?
Yeah. So Shrotas are just the channels of the body. And that can mean your big channels, like your whole digestive tract, or it can mean the little channels from cell to cell communication. So it's anywhere that your body or tissue or organ is communicating to one to another. It does through all these various channels. So Shrota is a channel, and that involves so many different processes, all the processes in the body, really.
So what's the importance of a Shrota?
So we know with blood flow, that's I think the easiest one to get our minds around is the blood flow. Like all of our blood vessels, those are all Shrotas. And we get a blockage. That's what leads to myocardial infarction. That's what leads to stroke. That's what leads to all of these ischemic processes, is a blockage of channels.
And I guess also carrying nutrients from one area of the body to the next too.
Yeah. And cell signaling, like when cells, I was listening to a podcast the other day and they were talking about cancer cells. And this has been really interesting to me with my recent work history in cancer research, but they were saying a cell that becomes disconnected from its environment becomes a cancer cell. It starts eating more than it can. That's why we see this like wasting away of people when they have cancer, and it becomes its like own entity. It doesn't act in harmony with the rest of the body anymore. It becomes its own thing. It's disconnected from the environment. And that's what Ayurveda teaches us. We're how to live our body in harmony with one part of the body to the other. We can't live in separation.
Absolutely. When you're disconnected from self, it actually affects the consciousness of that person and the collective consciousness. That's awesome.
And that's what made me think about it. It's so special because it reminds me of the consciousness emphasis in Ayurveda. Is when people, I see a lot of this like older people who are isolated from their families and they get depressed and they start drinking, and then their health problems accumulate. And we talked to them about drinking. And I had one lady the other day, I was the same exact situation. And she was like, I know I need to stop drinking. And she had so much shame, but then all of a sudden she bubbled up with, but this and this. And what it came down to is she was disconnected from her environment. She didn't have a social support anymore. She wasn't working anymore. And it's just like those cells that become cancerous. When we as individuals become disconnected from our environment and our people, we also become not functioning properly.
And so just to highlight, you just recently graduated, right, with your Master's of Science in Ayurvedic Integrative Medicine?
Yes.
And you attended Maharishi International University?
Yes, I did.
So why did you choose that school versus any other school that might have similar educational opportunities in Ayurveda?
There was a couple things. One was obviously where allopathic medicine is very big on like credentialing degrees being like a legitimate thing. So having a master's degree in something, it provides that scientific standing that the medical community likes to see to, I guess, get respect for or whatever. But then the second part was the consciousness piece of MIU, is that it's not just, we don't just practice these principles in a vacuum. Like you're doing it. Physical health is the foundation of developing your consciousness. It's almost like perfect health comes when you develop your consciousness, but you use perfect health as a way to reach your highest potential. Because when you are the same interventions that create good health, create your mind's freedom, it creates your soul's freedom. It digs into your purpose and your connection. And it's not just about health, it's about life, like life in general. And that was really what, even as an 18-year-old in nursing homes, like what I was seeing is that just because we have a breath and a pulse doesn't mean that we're truly alive. And that's what you see so much in healthcare, is that people aren't just struggling with health problems. They're struggling with life. Like they're struggling with connection, with love, with joy. Like those are the things that they're actually struggling with. And then in turn have these behaviors that create that health. So that is why MIU was so special, because it really emphasizes that development of consciousness in hand with the physical health.
That's really nice, because there might be people out there that are curious either in the program or as a client or patient in understanding the education that goes into this, because there are certainly practitioners that have that certification and or education, but not necessarily a Master's of Science degree, which to your point adds another layer credentialing to the knowledge and tying that in, and experience too with clinicals and seeing
Yeah.
patients or clients.
Yeah.
So that brings me to my next question. Let's talk about the Ayurvedic awakening. When you first encountered Ayurveda, what was your biggest aha moment that made you think this is what's been missing?
Yeah. So I was finishing my bachelor's degree. I had started like a couple years into my nursing career, and then I was starting on my for bachelor's degree. And as part of that, I did an integrative health class, I think it was. And this woman, we listened to all these different lectures. And it was about different modalities that were outside of allopathic medicine. And one of the women, she came in and she did a lecture on Ayurveda. And I was like, oh my gosh, this is everything. This is all of the pieces that we have been missing. Like through all of my questioning of why is disease created? Why do we have imbalances? Because up till then, I don't like the feeling, I don't think anyone likes to feel powerless. But like up till then, all of my questions in healthcare was, why does this happen? Why? Why? And I was just, all of the answers that I was receiving were so unsatisfactory. And then here this woman was giving this beautiful lecture about this ancient modality of Ayurveda. And she's like talking about cause and effect. She's talking about balancing. She's talking about keeping the channels clear. She's talking about how we support our body so that it can function properly. And I was like, yes, this is it. This is everything. So I was pretty hooked in that.
And it does differ. So Ayurveda views disease as an expression of imbalance versus disease. So how does this fundamental perspective change everything about how we approach health in comparison to the Western medicine model?
I think the big thing is how we approach imbalance of Ayurveda is we look for the causative factors first. And then once we identify the causative factors, we remove them. So digestion, causative factors, and then our metabolic buildup or ama, and then our ojas or our vitality and our life force. But really the emphasis on the causative factors, I think, is the one that stands out the most, is that in Ayurveda, we look at our causative factors and then we figure out how to remove them. And I think that's where the real work happens, because if you just say some of the causative factors, oh, they drink too much alcohol. But if we don't say, oh, why are they? We don't dig into the soul piece, a whole person approach, then us telling them not to drink isn't going to do anything but give them more guilt and shame. And that's not what it is all about. So, and then allopathic medicine, it's numbers, it's labs, it's disconnected pieces, it's very compartmentalized. So yeah, those are the big differences, I think.
Totally different way of connecting dots, right? You know, what's so interesting too is I would bet most people would be pretty surprised as to how simple those causative factors are.
Yes.
And the biggest challenge with changing those causative factors is most people have been doing these things for so many years with, I know I'm eating healthy. I know I have a good lifestyle, but there are some simple tweaks that are overlooked a lot of the times with what we've been taught with the Western world, and actually the reality of just simple things like food and compatibility.
Yeah.
So in your opinion, what are the very common causative factors that can cause imbalance in a person?
Yeah. So I think the big ones, actually, I was just talking about this with a coworker the other day, and I was talking about how Ayurveda emphasizes balanced meals and circadian rhythm eating. So we know that we're most insulin sensitive in the middle of the day. Our Agni, our digestive fire, is best in the middle of the day. And modern science is now proving that and showing us that's when we're most insulin sensitive. But we were talking about this idea of like balanced meals, 2 to 3 times a day, with all the fasting and all the other trends and stuff out there. That balanced meal approach versus like the old school approach of eat 6 small meals a day. And that was like a big thing. And I remember when I was a kid, like trying to get into health and fitness and stuff. And it was like, oh, eat 6 small meals a day to keep your metabolism going. And then now that we're seeing that like a lot of research does not support that, and more research is supporting circadian rhythm eating. So like a lot of our knowledge about how we eat, when we eat, where we eat, those things are often overlooked. So I know in nursing, oftentimes we're running around eating in a very like hurried, fast-paced way. And I used to eat on the run. I'd have stomachache afterwards. I'd be bloated. And then once I learned about Ayurveda, I would like make myself, either if I'm not able to, if I'm too busy to really sit down and take a break, I will eat very light. Or if I do get an actual lunch break, I make sure to sit down and eat it in a quiet environment and make sure that I am focused on my food. And that is a big thing that like, it sounds so simple. Sit down, eat your meal and focus on your food. But that's like a huge thing, that our food is our nutrition, and how we take that food in makes a difference to how our body assimilates that food into the nutrition and use it, and is able to use it and assimilate it into our body. So how we eat, when we eat, why we're eating, emotional eating is a big thing, addictive eating, addictive drinking. Those are all big causative factors that people are like, yeah, I know I shouldn't do this. Yeah, I shouldn't do that. But to really understand how they really impact and how they are causative factors for imbalance. I think those are probably like the biggest ones. And lack of movement. I think sedentary lifestyles, it's a huge epidemic right now. People, we send them home and they just sit in front of the TV all day long because they've gotten frail over time, and they're not able to move because they've stopped moving. And one of those use or lose the things.
And movement is important to move any of that energy that doesn't serve us out of our body.
Yes, definitely.
And then going back to the multiple meals a day with a lot of the trends that we hear about, 6 meals a day, the biggest issue is that there's not enough time in between those meals or those snacks to fully digest the previous one. And so when you have accumulated undigested food, it creates those toxins in the body.
Yeah.
So people understand the actual issue with that model, right? Aside of food and how they're eating and all of that, what would be the other predominant root cause that's pretty simple, one of the main things as an Ayurvedic practitioner that you want to address?
I think stress and emotions is probably another really big one. And like we've heard like chronic stress isn't good, but there's good stress and there's bad stress. There's good stress where we're getting pushed out of our comfort zone, or we're learning a new skill, and we're doing something different. And then there's chronic stress where your body is in fight or flight all the time and your nervous system is super dysregulated. And in Ayurveda, that's what we call Vata imbalance. And we're constantly dysregulated and we're constantly being stimulated. And we don't ever have that moment to allow the parasympathetic nervous system to do what it needs to do. That's a clear connection of how imbalance is created. And people are like, yeah, I know I'm stressed. Yeah, I know I'm too stressed. Yeah, I know I'm too angry. Yeah, I know I'm this. Or we just leave it off. But it's like, those are the things that are getting in the way of us being able to really enjoy our lives. Yeah. And we bring that stress home. And, without meditation and without the things that I've learned in Ayurveda, I used to bring a lot of my stress home, and I would be really uptight and be really tense a lot of the time. And it would lead to bad eating, bad drinking, not missing a workout, not doing the things that made me feel good. And when you know how to handle stress and your emotions, heaviness in the mind, it leads to heaviness in the body. And I think stress and emotions is probably the biggest thing that people could address to help with causative factors.
What about daily routine?
Yeah, it's another one too that like I hear so much in like especially nursing world. I used to work night shifts sometimes, and people are like, "Oh, well, I can't do that. I work this." And there are a lot of time constraints on routine in today's world, but we can always have it. We can always implement some sort of routine. And so Ayurveda teaches us that the body thrives on rhythm and routine. And so many of us, in something as simple as just like, I get up in the morning and I do my gratitude practice and I do my meditation and I do 10 minutes of yoga. Like doing a simple routine every morning, that can really make or break the difference of how you tell your nervous system we're safe, we're okay. And you can go into your day with that regularity.
Yeah. And so you mentioned that there's some gaps, right, in information, sometimes with Western medicine, and Ayurveda seems to fill in some of those gaps. What are the biggest gaps and how does Ayurveda address them?
Yeah, I think really a lot of the things we've already mentioned, like the causative factors and the daily routine, is a lot of people don't have a daily routine. The day they get up in the day, and it is where it's the external referral versus the internal referral, like that self-referral. We used to be like, I'm going to get up in the day, and whatever the day pulls my attention, that's what I'm going to respond to, versus being internally focused and being like, what do I want to put into my day? What do I want to bring to my day? And not letting the world pull me and shape me one way or the other. But the daily routine and how we eat, what we eat, when we eat, those are the big pieces of Ayurveda. Also, the emphasis on digestion, understanding that our bowel movements, how we're urinating, like how is our body telling us it's excreting waste. And like chronic constipation is such a huge, it's just a chronic problem. So many people have chronic constipation, and that's telling us our body is holding on to waste. So I guess really Ayurveda, the digestion emphasis, the causative factor emphasis, the daily routine emphasis, and the mind-body connection. Those are all the things that Ayurveda really uses to create a structure for a treatment plan for a patient.
So it sounds like we're conditioned in the Western world that these little things like constipation and occasional pain, bloating, all of those things really aren't highlighted or looked upon as things that are truly abnormal. But they are. And with Ayurveda, that's a huge focal point, was saying this is not normal. This is not how your body should be behaving throughout the day. And if you are feeling this discomfort, it is truly your body's way of communicating to you and saying, pay attention to me. You're giving me foods I don't like, or the routine is not good, or the combination of foods is not good, or the stress is causing issues with mind and digestion. So I think that's what you're meaning by that, in a sense.
Yeah. And I think there's like kind of this attitude of we have to power through. And there's good times to power through, like when you're like, I don't feel like going to the gym, but I know I should, I have the time, like that kind of thing. There are times when you have to mentally push yourself. But then there's other times where you're like, haven't had a bowel movement in 3 days, or you're so tense, you've had a headache for 3 days of pounding. And those are the things that people ignore. And then they end up in the emergency department. And it's like, that's your body is communicating to you. And Ayurveda teaches you how to decode what your body is telling you.
Thank you for that. So talk to me more about your experiences with your time with cancer research and what you witnessed with young adults in their 20s with advanced stage cancers.
Yeah. So I was in cancer research super long, like office job's not my thing, but I was there for about 10 months. And we would do these. So I was a clinical research coordinator. So we'd sit in on these tumor boards, and they would review cases that were coming across the table as like new cancer patients. And I was really surprised at the ages, because you always like relate. I don't know. I think it's a human thing. We see that and you're like, oh my gosh, what if that was me? What if that was me getting that diagnosis at such a young age? And these are women who are like moms and like young women. And you're just blown away. I didn't even know that was something that was happening at a greater frequency. And I would talk about it afterwards with the other ladies that were in research. And I was like, this is really concerning that we have so many young people getting diagnosed with cancer. And these like late stage cancers is super concerning. And because cancer research is great. There is a lot of things you can do if you get diagnosed early enough. But the fact is that people shouldn't be getting these diagnoses in their 20s. And people are like, oh, that's why cancer research is so important. And I was like, wouldn't it be more important to figure out why this is happening? And then I started doing my own digging, as I do. And I realized I found some statistics on it. And it was talking about how cancer is projected to rise by 77% in the next 25 years. And yeah, I see it in the ER. Like I see so many more cancer patients than I have when I first started in nursing. And what I saw in the cancer research was I was seeing it firsthand. This is happening. People are getting cancer is more common now than it used to be. So yes, cancer research is great and it has provided necessary medical care. But really what is important is that we do know so much about what causes cancer that we need to be doing more about preventing it. Toxins in our environment, the diet, insulin resistance, cardiovascular disease. There's so many factors that lead up to a cancer diagnosis.
Absolutely. And it's alarming as to what we're seeing with young kids. And I think that's being addressed, hopefully, soon.
Yeah.
With not just cancer, but other chronic illnesses in children and people in their teens that were unheard of decades ago. That in itself should cause pause, like the definition of insanity, right? What we're doing isn't working, so why are we continuing to do the same? We need to switch this up. your thought with this is why prevention is so important. In the Ayurvedic framework, how do we understand cancer? Not as necessarily a bad luck of the draw, so to speak, right? But as something that's deep rooted with preventable origins.
I think it's more of that how we lead our lives and how we take care of our children, really, what we're exposed to as kids, like the toxins in our environment and the things that we use on in our self-care, all of our products, all of the things that we're constantly coming in contact with. Ayurveda teaches us that they all have an impact on us. We are constantly metabolizing through the five senses, what we're seeing, what we're hearing, what we're tasting, what we're feeling. All of the things that we come in contact in our lives have a biochemical response on our bodies. So Ayurveda sees and understands how all of these things come together and can create conditions like cancer. And I think this is another one where it's really hard for me because I've tried to have conversations with people about this and they're like, well, it's not people's fault that they have cancer. And I was like, I know, I definitely would never say that it is somebody's fault that they have cancer. And I know that it can be something that's again, where that guilt and shame comes in, is that if you start talking about causative factors, people get very defensive. And I feel like you're placing blame on somebody for having a horrible illness. And that's not, I'm still trying to figure out the best way to explain that to people, where it's not about blame. It's not about you're responsible for your disease. It's just about you do have more power in how you live your life to stay balanced and not create a chronic condition like cancer.
You nailed it. It's empowerment. And I think a lot of us in the US have been trained that we don't have the power of choice, that it's just our genetics, which we're finding out that's not necessarily the case. It's more about us actually altering our genetics through epigenetics, and that gets altered through the foods that we do eat, the lifestyle that we live, the information that we take in, whether it's beneficial or unbeneficial, depending, like TV, social media, all of these mediums of ways of these other forms of energy going through our physiology will absolutely have an impact on it, right? Just
Yes.
you look at your garden and whether or not you put the right fertilizer in the garden or give it water and give it nutrients or give it a good soil to start with, that's going to impact the integrity of that plant.
Yeah.
That what you're trying to yield in the end. You can't just put all of these plants in the worst soil conditions where it's not going to actually have the ability to take in the nutrients and expect it to yield the same crop that you had with a really high quality, nutritious soil with a lot of water. And that's the same thing with the human body. And going back to your point about power, is we have the choice between being in, and I'm not saying that people are in a victim mindset, but essentially that they're not, they're powerless. They are empowered and they have the ability to make choices. I think where the challenges lie is, do they have the information? Do they have the education to make those choices for themselves? And going back to, there's so much information out there, can be very confusing. What is real? What is true? What do people even believe anymore? And so I think that's what creates that temptation with, I have gained weight and nothing has worked for me. No diets have worked for me, but they haven't identified what the actual root issues are with diets, with their lifestyle and all of those things that go into it. So now it increases the likelihood of taking a GL1, which is a medication that can have very negative impacts down the road with bone density, right?
Yeah.
For example,
you can have great results with that. I've had patients with that and they've had great results, but it doesn't fix the depression. It doesn't fix that you've been sitting at home and you still are lacking purpose or connection with others. And it doesn't fix all of those other things. And I really liked your analogy with the tree and the plant, because that was one of the things they taught us in Maharishi. He'd say, water the root, pick the fruit. Mm-hmm. And it's like healthcare is we're picking off dead leaves, but there's still toxic sludge coming in, pouring on top of all of the dirt. And we're wondering why we're still getting bad fruit from that. And it's like it's backwards world of it doesn't make any sense. And when you say it out loud, it makes a lot of sense. But then when you try and explain it to somebody who's really seated in that way of thinking that we've all been raised in, you can see that you can just see the wall go up. You can just see the block completely go up. And that was one of the things. So when I worked in cancer research, there was a very kind organization. They did a lot of things. They were trying to support the employees. But one of the things they offered us was like paid time off for like colonoscopies and mammograms, like all like the cancer screening procedures. They were like, yeah, take your day off. You don't have to use your PTO. We'll pay for your days off. And I was like, and I had emailed back and I had responded, what about paying for gym memberships? And can we look at the diet in the cafeteria? And I didn't get any response back. And I went to the cafeteria and I was like looking, I was really on this kick of I'm only going to eat whole foods. I'm not going to eat anything processed. I'm going to really try and do what I'm preaching with Ayurveda. And I would go in the cafeteria and I was like, I can't eat any of this stuff. If I really want to feed my body good food, there are so little options. And you have all these like chip bags that are flexing like non-GMO or non-this, and are like chips are chips. Processed food is processed food. Like real food is real food. We can't sugarcoat that, I guess. But
no pun
it's really
intended.
surprising. What's that?
No pun intended.
Yeah.
Can't sugarcoat.
Exactly. Yeah. And that was the thing. It was like, it's really nice and kind that they want to allow us to get these procedures, but all that does is detect when you have cancer already. You have the disease already. Instead of, how about you provide us gym memberships and time to take walks after lunch, or taking the time that's actually going to provide the diet and lifestyle that's going to allow for true cancer prevention. And just didn't get any response from that.
So talking about metabolism as a foundation, and in regards to metabolic dysfunction, obviously that's really important to make sure that your body has the ability to break things down to a more simple form so it can get rid of it and also absorb nutrients too that the body needs. How does Ayurveda view metabolism differently than conventional medicine?
Yeah, so before Ayurveda, all I knew about metabolism from conventional medicine, even nursing school, was really just you think about how quickly you can burn fat and how quickly you can, some people gain fat really easily and some people don't. That's all I knew about metabolism from the conventional medicine structure. In Ayurveda, we know that there's 13 different digestive fires. We know that there's one for each tissue. We know that we have our primary fire. So we have all of these different fires because our body is always metabolizing. Life is always changing. It's all like every metabolic process, for every bit of energy that is made, there's a byproduct. For every tissue or cell or anything that, like, if you talk about the renin angiotensin aldosterone system, that's like your blood pressure, how your body regulates blood pressure. For every single one of those enzymatic processes, there's a byproduct. So you're constantly having these byproducts for every single metabolic process. And like, I remember being taught some of that, but we don't talk about what happens when your body can't get rid of those waste products. And that is how things like kidney stones, gallstones, like all of those obstructive and building up processes happen, is when your body can't get rid of those metabolic waste products. So Ayurveda, in terms of metabolic processes, is an extremely more comprehensive understanding of what the body is doing in terms of metabolism than anything that I've ever been taught in conventional medicine.
Yeah, just simple things like the connection with digestion, metabolism. Can you just briefly talk about how, if there's issues with the digestive system and metabolism, can actually manifest into joint pain, for example? We have a lot of people that have fibromyalgia and all kinds of other joint issues.
Yeah. So I think a lot of that has to do with, we've heard a lot about leaky gut. That's been a big thing, and gut health and the gut permeability and those type of things. I think rightfully gut health has made this comeback, but what happens is when we lose that gut integrity, you have things sneaking through your intestinal lining that's not supposed to sneak through. And that creates a chronic inflammation, or it creates those metabolic wastes. They have to find somewhere to go. And it can create infection somewhere in the body, or it can lodge itself in joints. So it can lodge itself in lots of different places. And depending on where it localizes, that's where you see all these various conditions that are becoming so common right now.
And we know that one of the big causes of that, with causing the leaky gut or issues with the digestive system, is processed foods, right?
Yes.
Because some of those chemicals can actually potentially block one's ability to absorb those nutrients because of what it could lead to in the gut, like leaky gut, for example. And then we start to see celiac disease potentially and other food intolerances, where if they can remove the causative factor, which is 9 times out of 10 processed foods or incompatible foods, like you said, when they eat their foods, with their daily routine and all of these things, they could probably remove all of those issues altogether. What do you think about
Yeah.
that?
Yeah. I was actually listening to a podcast about this similar, and I was like, I love analogies because they just bring the situation to life. Like, and it's this, all of the things that are happening inside of us, we can't like picture and really understand how important they are. And then you just think about, so this guy was talking about our gut lining being like a shag rug, and you have all of those fibers, and how you need more fibers you have, the more your body's able to process and absorb and do everything that it's supposed to do in your gut. But when we've had exposure to processed food and all of the things that are causing all of the problems that we're seeing, is that you have more of the flat rug. So you're supposed to have the shag rug inside of your stomach, and you're like, what you're actually supposed to have is that, what you're supposed to have is the shag rug. And what you're not supposed to have is that like flattening or the lack of those little villi that absorb and do all of that protecting of our gut. So you're like, that makes total sense that if processed foods wear down that gut lining, it's not going to be good at doing its job. So to put it in terms like that, try to explain this to my teenagers, and they're not entirely convinced, but it is something that you have to really, I think, get people to intellectualize, where we're not just being health nuts. We're not just being picky and high maintenance. It's really important. Our gut lining and its integrity is so key to our health.
Yeah, absolutely. Great point. I like the use of analogies. That helps to give a big picture to any of your clients or patients that you're seeing, so they have a visual, right, of a comparison. So great job on. Do you have a personal story that you want to share from your past that maybe opened up your view to looking for something better with healthcare? Personal story, and this is what kind of brings us to another way. That's certainly what brought me to Ayurveda, was whole health. Do you have a personal story you want to share?
Yeah. So I guess a lot of my personal story is around my relationship with alcohol. So ever since I was a young person, I always struggled with alcohol. And it was one of these things where I was raised in a really dysfunctional home, and I knew that life could be good. I knew that there was something more out there for us, but I just couldn't figure out the way to get there. So I was really big on the fake it till you make it thing, that there's something in life where you have to feel discomfort. And I didn't know how to do that. So I would do the fake it until you make it thing until I couldn't anymore. And then that's where alcohol came in for me. And it made me be able to stick with that. Everything's fine. Everything's okay. And then I started getting some really bad consequences in my life with drinking. And I did the AA thing for a little bit. I've done some kinds of therapies. I've done a lot of work with a lot of like therapists, and a lot of those things are good supports. But what I found in meditation and Ayurveda and understanding my own consciousness and understanding the needs that I was trying to sell, I don't think I could have found those answers anywhere else. And I think that's a big part of, I used to be really resentful of my relationship with alcohol, because I was like, it's such a big part of our culture. Why can't I just do it like everybody else? And the fact is that I can't, but it's been one of my greatest blessings, because it helps me understand when we tell somebody something like, you need to eat better, exercise, like health behavior isn't always easy to change. We need to really get to the understanding of any action that we're taking, it is serving a purpose. For one reason or another, it is serving some sort of need. It is filling some sort of need for us, whether that's comfort or suppression, but the thing is that when we eat or drink or do anything because we're trying to suppress our feelings, it suppresses the good and the bad. And that is what is really beautiful about Ayurveda, is that helped me feel the discomfort of growing and be okay with it. And it helped me experience joy and gratitude to a higher level also. So I think my story with alcohol has been, it's really humbling, and it's hard to admit sometimes, because you're like, oh, you know what, people are going to have, there's always cliches around drinking, and people are going to trust me, or they're not going to trust my judgment or whatever. But I think we're all addicted to something. Some people are addicted to stress. We're addicted to how we look. We're addicted to making sure our money looks a certain way or our bank accounts look a certain way. Like we're all addicted to something. And when we get to that point of, I want more in life, I want like a deeper experience of life, those addictions can be getting through to the root cause of what is making that health behavior happen. And really, it's like where all the freedom comes. And it's just breaking through that barrier.
You just said that liberation, breaking through that barrier, and that's where the freedom comes. And that's the key, right? And you're right. Addiction comes in different forms. It's all about energy, right? And attachment. And so typically what a person will do is they'll glom into something, whether it's work or food or substances or a person, right? Things like that. And that is a way to fill a void that we have to ultimately figure out how to connect with ourselves, because that's how we fill that void, is from ourselves versus an external object, person, place, or thing, rather. So the beauty of it, I think, is what you're trying to say is it's the experience that you can draw down to have that empathy and open heart and open mind, coming from a heart space to understand another person's challenges in their journey and connect with them. And actually that vulnerability creates an opportunity for connection, not only with yourself, but other people. And that's actually what's going to build trust, right? So that liberation of attachment and being vulnerable leads to connection, and that leads to healing. And again, going back to consciousness, right? So thank you so much for sharing all of that.
Yeah. And I've had a couple really cool experiences with patients, and I've always very cautious about how much to share with patients or people, but emergency department, you have a lot of drug users, you have a lot of alcohol problems coming in. And sometimes I look for the moments of some people don't want help, and that's fine. We're not here to force, everybody's journey is their own. We're not here to force anything on anybody else. But you see those windows of opportunity, and the times that I've taken them and I've talked about it, like, hey, are you interested? Have you ever tried AA? Have you ever tried meditation? Have you ever tried this or that? And some of the conversations that I've had with people have been so beautiful and so just, it could be a patient that the doctor just left that was like, guy in room 2 is a real jerk. We just need to get him out of here as quickly as possible. And I go in, and because we have this connection of, yeah, we're both messed up, let's talk about it. And you just have these really cool conversations with people, and it can be really beautiful. And then there's other times where you go in and you're like, yep, they don't want to talk about this. They are cool with drinking themselves to where they are, and that's okay too. And it's just, that was part of my healing process, is accepting people where they are, is that I'm here to, if people want to talk and they want to be loved on, I'm here to do it. And if they don't, then that's okay too. And you look for where the universe is guiding you to help. You do what you can.
Absolutely. And although people might view it as messed up, I like to look at it as redirection and re-guiding. It's our soul is showing us another option. So when we feel resistance or challenges, so to speak, life challenges, that's just our own soul or body or mind saying that's not the right direction for us to go. And there might be people who do consume alcohol who don't have those challenges, but that's just, they have a different path, different purpose. So it's just gently or not gently, depending on the situation, redirecting us on another path.
I think that's a beautiful way of saying it. That's so beautiful, because it is redirecting. Like even with the health symptoms, like to go back to the health symptom thing, or what you're experiencing in your life, like you can like, and the empowerment thing, you can choose to be like, oh, why me? Why is this happening to me? This is so frustrating. I don't understand. Or you can be like, okay, what is life trying to show me? What is my body trying to show me? What is my own soul trying to show me? And it almost becomes this game of figuring out the answer. It's like this challenge of, okay, what is the redirection? What am I supposed to be doing? Because that's all it is. Like life only has good things for us. And if we follow those redirections, we are like unstoppable. So I like that redirection. I think that's a good word for it.
Awesome. Thank you. So let's go into a little bit more about Ayurveda. We'll talk about the pulse. A lot of people they're like, oh, my pulse is like 70 beats per minute, for example. But with Ayurveda, when we use the pulse, as a way of detecting an imbalance in the physical body, right? Do you have a brief description as to what that entails and why we use it?
Yeah. So in Ayurveda, we're looking for what the doshas are doing in your pulse. So I guess for people who don't know what the doshas are, it's essentially the energetic principles. So three energetic principles that determine and structure all of matter in the universe. And so you're looking for what are the doshas doing in that person's physiology. And we can do that by, there's different qualities that we feel in the pulse. We've all felt like our heart's beating through our chest. But when you can feel each of the doshas have a house in the pulse, and each dosha has certain qualities that you would expect to see in a balanced state. So that's what you're doing with an Ayurvedic pulse reading, is you're looking for the balance or imbalance of the doshas in that person's physiology.
As
So it's pretty cool.
excellent description, by the way. Thank you. So when you're taking the pulse, what's the experience like? When you're taking the pulse, you're using all three fingers, your first three, your pointer finger, middle finger, and your ring finger. Does it matter which arm or wrist rather? What is the experience like?
Yeah. So typically for men and women, men, it's on the right wrist, and for women, it's on the left wrist. And it's pretty beautiful. It's unexpected. I remember the first time I was a client at clinicals, and you have 20 different people all coming up and taking your pulse. And you feel this weird, it feels like therapeutic. You're being loved on. Like somebody is just observing and being with you where you're at, and they can just feel, you're just kind of observing somebody's consciousness through their pulse. And it's just like synergistic. Sometimes you can feel different people feel differently when they do it. And I don't know, it's pretty cool. But when I was in India, I had Vaija. She took my pulse in the context of my consultation. And it was so cool because she did all of the normal modern medicine stuff, but then she also took my pulse. And it was so cool because she was like talking about doshas, but she was also asking me about like medical history and all of those like normal things. So to see that merging of, she was lining up what she was feeling in my pulse with what I was describing to her for symptoms. And it lines up. Like my husband, he was skeptical when I first started describing to him, like, hey, can I practice pulse on you? But it's pretty legit. So it's a really beautiful experience.
It is. So essentially, you're picking up the reverberations of the consciousness of the person, right? I know that might sound really abstract to a lot of people, and it was certainly for me when I first started learning about this. But ultimately, you're picking up reverberation or vibrational pulsations from the person's physiology in each of your fingers. And each of your fingers essentially, in combination, will tell you where those balances or imbalances are occurring in the physiology in the person. Is it in the digestive area? And there might be multiple signs that you're getting that information. Could it be from low back pain, for example? Could it be the eyes? Could it be inflammation, joints, for example, the hormone areas, and where things are out of control, maybe exacerbated, or where they might be depressed, essentially, or depleting, rather.
Yeah. Yeah. I know my husband, he had pretty serious eye problem. There was like a bubble or a fluid buildup behind his eye, and it was causing some like visual disturbances. And it was interesting to feel that part of Alochika Pitta we know it's our subdosha that governs the visual system, internal and external. And you could feel that part of the pulse in him. And then as it got better, you could observe the difference as it would happen. And my husband was like, how do you know you're not just like forcing what you're expecting to see in it? And I was like, you can feel the change, like over time, you can definitely feel the change. And he's also been with me in this alcohol journey of not drinking. And you could feel as his pulse would relax. He used to have a very like bounding, hard, sharp pulse. And over time, his pulse has gotten more soft, more relaxed, more balanced in all the doshas. And it's really interesting. And I used to practice actually when I worked in ICU for a few months. I would practice on my ICU patients. And sometimes I'd be like, you can just barely feel a pulse.
Right.
And you're like, it's just the lack of ojas because they're so in such a deteriorated state. And you would see that reflected in their pulse. So it's interesting as I've gone through the Ayurvedic clinicals where you would People have an expectation of what somebody's pulse was going to feel like based on like how they came up to you. And sometimes it would be totally spot on, and other times it wouldn't. And morph and be changed and to be different. But it like refines your perception of how you perceive, because it is such a subtle reading or interpretation that you're picking up on about somebody. But it really refines your perception. It's like going from 3D to 4D.
That's a great analogy. And yeah, and going back to ojas means vitality and life force. Is that how you would define that? Just so people know what that means.
Yeah. So your ojas is essentially your, like, how much vitality and vigor your physiology holds.
Yeah. And as someone is ill or their health deteriorates, your ojas start to deteriorate too. Okay.
Yeah.
And we do look at that with the pulse. We talked about detecting imbalances before they manifest as disease. Can you share an example of when a pulse diagnosis reveals something that would normally show up in standard medical tests yet?
So I don't have a very personal example of this, but when I was in India, I remember hearing this discussed a lot, and they would talk about how they would feel these certain things in the liver or the different parts that speak to the digestive process. And then the patient would go and have these follow-ups, and it would confirm what they were told beforehand by the Vita, by the pulse reading. So I don't know, besides my husband is probably my best, like most personal example of when I would feel things, and I'd be like, hey, how was your bowel movements? Or hey, how is this? And they'd be like, actually, and we'd talk about it. So it was like, that wasn't like a huge mind blowing thing, but it would like spark conversation, and he would be like, yeah, actually there is this going on. But I know that was something that was spoken of quite often in clinicals.
Yeah. And I have heard also that there's studies that have shown where there were indications in the pulse, for example, osteoarthritis, right? It put something that's affecting the bones or bone density. There's a reduction in hormones or imbalance with hormones and an imbalance in that area of the body. And like an alert saying, if you continue on this path, you could go into osteoarthritis. It could manifest that way. It doesn't mean it's going to, but there's a likelihood. And it wasn't picked up in blood tests or diagnostic testing rather, but then eventually did manifest that way years later, right? Maybe a couple of years later. So I have heard stories about that. That's just one example. Just so people are out there to understand that the benefit of Ayurveda is it can absolutely detect or see imbalances that could potentially lead towards some of these chronic illnesses down the road.
And I think that's a really important one too, to emphasize, because osteoporosis and things to do with the bones, sometimes there isn't anything that tells you it's there or anything that's wrong until you have a break or something, a fracture, something that happens that all of a sudden, like, I didn't know I had this as an issue. And I think that is a really good point too to bring up is in clinicals, we would see like somebody would have something in like sadhaka or prana where you had your mind and your heart, and you would see that imbalance in their pulse. And then you would go on to interview the client, and you would see, oh, they had an old trauma, or they had something really emotionally heavy. And then you would see that in the pulse, and you're like, wow, that's actually, I felt that in their pulse. And then here they are expressing that. And then those are one of those things that, like, if you came to an allopathic doctor and talked about emotional trauma, they're going to refer you to a therapist or somebody else to take care of that. But that tells you those emotions will manifest in the body in some way or another at some point if they're not addressed.
Definitely. So when you're working with clients that are also seeing conventional doctors, how do you navigate the potential conflicts between Ayurveda or the Ayurvedic recommendations that you may have and the standard medical advice that they're receiving?
Yeah, so my practice is very new, so I'm still working on getting some clients to work with in real time. But when we would work in clinicals with patients who were seeing other doctors, the biggest thing I think is to make sure that there isn't any kind of contraindication between foods that we're recommending and the medications that they're already on. So that would really be the only contraindication or something that we would have to be worried about. And sometimes certain herbs contraindicated with certain medications. So just making sure that there's no contraindications as far as current medications that are required for patients. But other than that, a lot of lifestyle things that we're recommending, there aren't contraindications for. There isn't, we recommend walks in the morning sun and walk 100 steps after meals. Like conventional medicine's not really going to have a problem with that. There is some delicacy as far as what you promise. You can't promise, I'm going to cure your disease, or I'm going to cure your this or cure your that. But you can say, I'm going to support your doshas, and I'm going to bring balance to your doshas. And the byproduct of that may be a reduction in your symptoms, or should be a reduction in symptoms.
So can you talk a little bit about your practice? You said you're building it up. Do you have like a focal point, what you specialize in, and which types of clients you support?
Yeah. So right now, my focus is really women and insulin resistance. That can really be expanded to more of any kind of metabolic disorders, because you don't need to have a diagnosis of type 2 diabetes to be experiencing insulin resistance, PCOS. And there's so many other conditions that are correlated with having insulin resistance. But for me, I was trying to figure out how I wanted to bring my degree and what I was doing into the world alongside my current background. And so much of what I'm seeing, like the kid with the high liver enzymes, the high blood pressure, is we're sending people home with crazy high blood sugars, and they have no history of type 2 diabetes. And they're like, oh, I'm not insulin resistant. No, my A1C is fine. Or no, this is that. And it's just, but you're seeing these people with these fasting blood sugars of 140, 160, 180, and they're completely unconcerned by it. So my focal point is really to help people see those numbers and use their own critical thinking, and help bring that education to, so they can look at that information and understand how they're feeling and correlate it with their blood sugar levels. Because our blood sugar is really, it is how we make energy. And that's what Ayurveda is all about, is our ojas, how much we're able to have energy in our lives. So insulin resistance is so heavily correlated with things like cardiovascular disease and cancer, that my main focus is insulin resistance in women right now. Actually, it was really interesting because this is a man patient I had, but he was very sweet. And I asked him, I was like, did you know you have a fasting blood sugar of 150? And he had no idea. And he didn't have type 2 diabetes, and my discharge instructions didn't even mention it. And he had just had kidney stones and gallstones. Mm-hmm. And he also had high blood pressure. And I was like, so your body is telling you metabolically you have something going on. And I was like, I have to be careful to not speak outside of my scope, because I'm not a doctor. But I do want to make people aware, like, this man had no idea that he had a blood sugar of 150. And he had no history of type 2 diabetes. And his body is chronically building stones in different organs. I just think metabolic and health in general is such a good focus point. So that's what I'm focusing on right now.
I think the metabolic and health would be gut health too. And that could be a way that you can expand your business, not just on the insulin resistance, but maybe what leads up to it, right? It's the gut health, the imbalances in the gut health. And maybe that prevents people who are having gut health issues or hormonal imbalances, which potentially could, or stress, which can lead to PCOS and all those things. Maybe that kind of helps to scale out your group of people that you support, because now you're preventing them.
Hard. Right, because they are they're all connected. It's like you can't touch insulin resistance without talking about gut health and like hormones, and like all of those things are so interconnected. So it is really like you don't touch one without touching all the other ones.
Yeah. But if you look at a nutritionist, right, that's what they focus on. They focus on what they're eating, because it can lead to gut health issues and endocrine issues and hormonal issues, and all of those things, all those systems go together. So just maybe something to think about. It'd be interesting to see what people need. What would help the majority of the folks that are seeking out another way? Would it be gut health? Would it be insulin resistance? It'd be a good opportunity to get that feedback.
Yeah. I know. I'm looking forward to see which population I end up falling into. Because right now I'm working on a 12-week diabetes coaching program. When I first started my practice, but a lot of people would say, oh, I'd get one person, one client, I'd see them, they'd be really interested, and then I'd never see them again. And I was like, I really want to work with somebody. I want to get to know them and understand what are your causative factors and what is blocking you from changing them. What we do with modern medicine is we give you a prescription, say, take this, and then we'll come back and talk about it in 6 weeks or whatever. And I want to work with them where I'm like, if I tell you to get up and walk in the morning sun and you're not able to do that, why aren't you able to do that? So that's why I really want to find clients that want to commit to a certain block of time to work together to see if we can unbury whatever is blocking them for that time point.
That's a good approach. Can you talk about a little bit about your product that you're offering with the diabetes coaching? You said 12-week program.
Yeah. So it's called the Metabolic Reset Collective. My intention is to have it start with a 2-hour Ayurvedic consultation, typical to what we do in clinicals, where we would uncover what is your digestion doing? What is your mind-body type or your prakriti? What is your ama? Is ama a big part of it? Your metabolic waste. And just really digging into their case, getting a good sense of digestion, ama, mind-body type, and just really understanding those what causative factors. Is it stress? Is it work-life balance? Is it sedentary lifestyle? Because everybody is going to look completely different from one person to the next. So initially, I'm going to start off with an Ayurvedic consultation. And then I'd like to do I want to build it into a group product or group structure so that you can, because we do well when we connect with others. Like we see this in clinicals, we see this in AA, we see this in places that actually make big transformations. You do it better when you're in connection with other people. So 12-week program, education, understanding how to set up a daily lifestyle. And the Ayurvedic consultation would give you a focus point of if you are predominantly a Kapha type or predominantly Pitta type, what your exercise and diet needs to look like according to your mind-body type. And then over the 12 weeks, work on building out that lifestyle and that diet according to whatever barriers they have individual to them.
Yeah. And what I'll probably do to just follow up on this is I'll link Krysta's information in the bio or in any of the social media posts that we're doing, including on the podcast, but also links to where you can take a dosha quiz and you can figure out what your predominant actual physical makeup is. And that's determined based on physical attributes and personality style a lot of the times. And so that will help people connect those dots. And a lot of people seem to be visual so they can see for themselves, oh, wow, look what this is. And then just see what Ayurveda is all about. That kind of leads me to the next question, Krysta. What's your response when you may hear skeptics say Ayurveda is unscientific, things like that, or it's a placebo effect, especially when it comes to practices like the pulse diagnosis?
I don't know. It's so interesting to me that anybody could even, make the comments that Ayurveda is non-scientific because if you look at, we have a healthcare system that says that it's evidence-based. Everything is evidence-based medicine. That was drilled into me in nursing school as evidence-based. But the evidence couldn't be clearer that our healthcare system is not producing good outcomes. We spend twice as much on healthcare as any of the other wealthiest countries in the world. And we have the poorest health outcomes, despite all of our state-of-the-art interventions, despite all of the things that we have. We do more heart surgeries, more chemo, more anything than any of the rest of the world. And we have the poorest health outcomes. So our evidence-based system is showing the evidence that we are failing. And then there's so much evidence that around lifestyle. And I have been searching and NIH and PubMeding and reading and podcasting and all of the things to make sure that what I am teaching in my practice is grounded in factual information. And the evidence couldn't be clearer that lifestyle is medicine. And that's what Ayurveda is. It's understanding how to create your lifestyle. And there isn't any way that Ayurveda isn't scientific because it puts out these amazing. When in India, we had these patients who they go there to get these eye treatments. And there was one woman, she was in Cosmos actually, and she went to all the best specialists in Philadelphia for her eyes and didn't have any result. And then goes to India and has these treatments. And they were able to completely save her eyesight because of these deep panchakarma treatments that she was getting. And it was how can you not say that this is scientific. Like you did an intervention and you got
Mm.
this amazing outcome.
Right.
That's what science is. We have something that is, we can replicate and duplicate over and over again. And that's what Ayurveda it is. You implement these strategies, these principles, these understandings, and you get these incredible results. That is science. So
Yeah.
I don't really understand the claim that Ayurveda isn't scientific, I guess.
Agreed. And I think that's probably diminishing as time goes on, as more people are learning about this. Just out of curiosity, do you have any idea what type of eye vision issue this person was having?
I don't. I want to say it was something to do with a diabetic retinopathy, but I
Okay.
can't remember her particular. She had it. No, I don't remember exactly what it was that she had, but I just remember it. And it wasn't just her story either. We had multiple
Mhm.
people that like the Vijas as they went through, because it was the whole 2 weeks that we were there. It was about Panchakarma, which is about the Ayurvedic, the deep detoxification and very like deep dosha balancing approaches that they do. And they had multiple stories that
Did you
mirrored
hear-
this lady's.
Did you hear any stories about macular degeneration and the treatment for that or the approach?
That was one of the things that they would reference, but there was so many.
Yeah.
There was so many amazing stories. They had like
Mhm.
newspaper clippings of these, like
Wow.
people giving them recognition about it. And they're really committed to studies and research in the hospital that we did our clinicals in. So they were really trying to bring this stuff to mainstream as well. And I
Yeah.
think just the constraints, pharmaceuticals and all that stuff is shutting it down a little bit, but it was pretty amazing to see
Well,
firsthand.
I'm sure that more will be coming in the future. on that.
Yeah.
So, in your experience with looking at the outcomes and success stories with transforming health, is there a difference? What's the determinant factor in most of these cases? Is it willpower or something deeper with whether or not someone can transform their health?
I think some of it has to do with, I don't know, I don't want to say faith, but some sense there's faith, it's belief in, like the more that you listen to yourself, the more that you understand yourself, and the more the changes that you make are just, it's a synergistic thing. Like the more you understand yourself, the more you listen to yourself, the more you listen to yourself, the more things start to change. And I think if anybody was to do these lifestyle changes with grumbling and anger and frustration, I don't think they would get the same outcomes. I think it is a heart transformation that has to occur. If you are taking the morning walks, but you're mad that you're getting up so early every morning and you're like eating according to your circadian rhythm and according to your dosha, but you're doing it with grumbling and frustration, I don't think you would have the same results as you do when you have the holistic mind of, I'm understanding myself. And I'm doing what is nourishing and feels good for my body. I think the results are really determined on your heart and your mind.
Well said. So, vision of healthcare. Let's go there. All right. You want to be a part of a new movement, right?
Yeah, it's very much.
With exciting things that are on the forefront of healthcare. Lots of changes we're already seeing. What does this new paradigm look like to you?
I think it's the meshing of the two worlds, like really putting each, like respecting each modality in their own right. Because you do need mainstream medicine for certain things. If you have a trauma, like I definitely want to be in the emergency department with all of the interventions that they have available to you. But as far as prevention goes, really building up the education around lifestyle and how it produces health. That's what I would really like to see, especially with the kids. We have that's the next generation. And if you have sick kids, you're going to have a next generation of sick adults. And I think the vision of healthcare would really be the merging of the two worlds and really focusing on true prevention through lifestyle. So with my son, like he goes to school and they're like, it's snack time, cupcakes every other week. It's always somebody's birthday. And it's always like the cafeteria food is full of junk food, full of processed food. And we need to celebrate. Yeah, we need cupcake days. Sure. But like, how can we take out some of the toxic ingredients that we're leaning on so heavily? How can we not over sterilize our environments and just really coming back to our environment, connecting to our environment, coming back to nature? really emphasizing that we need nature in our environment and in our world. But I think it's going to be hard because I'm not big on politics. I'm not big on the administrative part of healthcare. There's a lot of blocks. And I think people need to be empowered to make the changes themselves and can't rely on the government, our doctors, those big agencies to tell us what to do for our health. It's really about individuals being empowered with that knowledge. And that's why I think Ayurvedic practitioners are so needed, because you need to work individually with somebody to understand what's going to be right for you. Because doctors right now, they work out of algorithms. Everything's an algorithm. Everything's a standardized process. And that's not what Ayurveda is. And that's, I think, the really ideal situation in the future would be merging the two, whatever way can happen.
3 things that all go hand in hand with kind of what you just said. Freedom to choose what healthcare that they want for their body, and freedom to choose what they do put in their body, check to see the quality of those foods, and health. Those things all go together, right? And safety is a big importance with that. So freedom, health, and safety is the way I look at it. And all of those 3 things do create wealth in an individual. I'm not talking about money necessarily, but abundance in all aspects, right? Because your health is your wealth.
Fair.
If someone is curious about Ayurveda, but they're just not sure about it, right? They don't know enough about it, or they're not getting enough education. How can they look into this? What would be the first step that they would take? What's your suggestion?
I think finding an Ayurvedic practitioner would be like the gold standard of, let's have a conversation and see if you're asking the right questions, if that aligns with, because so many people, they come away from the doctor's office and they leave feeling like they weren't heard, but they didn't get an answer. So go have a conversation with an Ayurvedic practitioner and see, are they asking all the right questions? Are you being heard fully? We shove off so many small symptoms, but like those small symptoms are the things that Ayurveda is like, oh, tell me more about your constipation. Tell me more about your anxiety. Like the things that the doctors are like, that's nothing. That's fine. That's whatever. Like those are the things that Ayurveda is going to be like, tell me more about that. And I think if somebody has questions about Ayurveda, you go have that conversation and see how you feel when you leave. If you feel heard and seen, maybe you didn't leave with, don't have this perfect plan to turn things around right away. But that's good, because real change takes time. But if you have a practitioner who's, look, I'm ready. Let's dig in. Let's get on this journey together. Let's spend the time to figure out what it is that is causing these symptoms, and let's figure it out together. Not, here's this pill and we'll see you in a little bit.
And part of the therapy process is being heard and feeling validated. And going through that root cause actually helps to support that validation. So where can we find you, Krysta?
I am on Instagram. I also have a website. It's karmavedawellness.com. But my Instagram handle is at Krysta Clark Coaching. And those would be the 2 places that I would start. And through Karmaveda Wellness, I am connected to Connect for Healing telehealth platform.
Okay. And we'll link all of those in the podcast information when we post that too. Is there anything else you'd like to add to the end that we didn't cover?
Oh, I think I just want to say thank you so much. I really appreciate having these conversations, because it's so easy to feel like you go in the world of Instagram and you're like, everybody knows about functional health. Everybody knows about all the things you can do. And then I go back to work and I'm like, no, nobody knows. Nobody knows how much we can actually do to change our health. So it's always a privilege to be able to have these conversations and keep being part of just spreading the word that we have so much power in our health and how we live our lives.
Absolutely. Ayurveda everywhere, right?
Yes.
And just so you know, I encourage you all to check out Krysta's information that we're going to provide in the podcast information. She does a great job with some free educational tips weekly, at least, sometimes daily, with what you can do with your endocrine system or your metabolism, specifically diabetes and women's health. So lots of free tidbits out there, and I encourage you to reach out to her and check out more about Ayurveda. And I think that's a wrap. Thank you so much for joining me today, and I'm so honored for you to share your knowledge.
Thank you.
Have a great day.
So,
in closing, what strikes me most about this conversation is about how it challenges us to think bigger about what healthcare could be. We're not talking about discarding modern medicine. We're talking about enhancing it, about honoring both the life-saving interventions of modern medicine and the deep preventative wisdom that could keep people from needing these interventions in the first place. The future of healthcare isn't about choosing between stethoscopes and pulse diagnoses, between pharmaceuticals and herbs, between treating symptoms and addressing root causes. It's about integration. It's about seeing people as whole beings, body, mind, and spirit, rather than collections of symptoms to manage. If you're a healthcare provider feeling burned out by the limitations of conventional medicine, or if you're someone who's struggling with chronic health issues that seem to resist traditional treatment, I hope this conversation plants a seed. Fundamental transformation, whether it's personal healing or a systematic change, begins with a single question. What if there's more to health than what we've been taught? The answers might be more ancient and more revolutionary than ever imagined. Thank you for listening. Until next time, remember that your health is not just about your genetics or luck. It's about the 1,000 small choices that you make every day and the wisdom that your body holds when you're listening to it. We are interested in feedback on our episodes and learning what topics you may be interested in for future episodes. Please follow us on Instagram, Your Health is Wealth Podcast. Also, our website, yourhealthiswealth.com, and is spelled with a Z instead of an S for yourhealthiswealth.com. The link to the website is also found on the Instagram bio as well. On our website, we list the episodes, and there is an online form where you can fill it out, share your feedback, ask questions, share input on future topics, and also contact us if you're interested in being featured on the podcast. Topic scope is related to health and wellness. Thank you very much for listening to our podcast today and look forward to more. Have a great day, everybody. Take care.